This skill is supraglottic airway device in an adult. So before I start my skill, BSI, scene safety. I'm gonna come up to my patient, assess for responsiveness. I'm going to touch him, tap him, sir, can you hear me? I'm gonna come up, assess his pulse, listen for breathing, looking for adequate chest rise and fall. He has a pulse, but I can see that his airway is compromised, so I'm going to need an airway adjunct. So I'm going to then use the correct airway. I'm going to place the OPA, the corner of his mouth, to his earlobe. I'm going to open up his mouth using scissor technique. So I'm going to open up. I'm going to then place the OPA at 90 degrees and insert the airway. I'm going to use a BVM to provide supplemental oxygen. 1 breath every 5 to 6 seconds while using the EC clamp. So I'm going to attach my capnography to my monitor. I'm going to also place my patient at high flow oxygen, 100% oxygen, at least 85% as well. So I'm going to pre-oxygenate my patient before I attempt to use my supraglottic airway device. So I'm going to continue to pre-oxygenate the patient for about 3 to 5 minutes. While I'm pre-oxygenating my patient, I'm going to get my device ready. So that is to secure my device to the patient. So I'm going to have my eye gel right here. Okay. I'm going to make sure that I lubricate the eye gel along with lubricating the tip of it. I have everything ready. I also have my my ears, which are my stethoscope, so that way I can auscultate the patient's chest bilaterally, assessing for adequate chest volume. So I've just removed the BVM, placing the patient. I'm going to remove the OPA. Okay. I'm going to place the patient in midline position. I'm going to use tongue jaw lift technique. I'm going to insert the eye gel. Okay, it is in. I'm going to note the depth. I'm going to attach the BVM back. I'm going to deliver a breath, looking for adequate chest rise and fall. Okay, I'm going to note that. I'm going to have my partner BVM my patient while still holding, giving a breath. So my partner is delivering breaths. I'm going to auscultate the chest. Breath, breath, breath. One more breath. Okay, so I've confirmed that I am oxygenating the patient's chest. So I'm going to then secure the patient's device with a strap, making sure that it is on there and not going to come off, noting the depth. I can then mark, maybe with a marker, noting the depth of the patient where his teeth meet the airway device, so that if the airway device does slip, I know if I'm pre-oxygenating the patient in the lungs, or if I've removed the device too much and it is not rendering enough care to oxygenate the patient. So I'm just going to continue to deliver oxygen to my patient until the patient becomes responsive, or I see positive results in regard to the patient's care. I will continue ventilating with 100% oxygen, looking at capnography to make sure that I do and am ventilating the patient in the lungs.